Good evening. Since I last spoke to you from this podium, we've continued to make progress nationally against the virus. We are now reporting regularly fewer than 1,000 new cases each day. The Office for National Statistics estimates that between the 14th of June and the 27th of June, the most recent period they have analysed, 25,000 people in the community in England had the virus, one person in every 2,200. SAGE assessed that the R rate, the average number of people each infected person passes the virus onto, remains between 0.7 and 0.9 across the UK. SAGE also assessed that in England, the number of new infections is shrinking by between 2 and 5% every day. And while the number of people dying with coronavirus remains too high, the numbers do continue to fall. Now, of course, this picture is not universal. There are areas such as Leicester where the virus is still more prevalent than we would like. We always said there would be local outbreaks requiring local action. This is to be expected and will, I'm afraid, be a feature of our lives for some time to come. But that should not take away from the great progress we've made together as a country against this vicious disease. This progress is the reason why we've been able slowly, carefully, cautiously to ease the national lockdown. Without doubt, lockdown has saved many hundreds of thousands of lives. But it has also had a devastating impact on our way of life and our economy. And of course, lockdown has not yet been lifted entirely. Indoor gyms, nail bars, swimming pools are still closed. Mass gatherings are still prohibited. Social distancing is still essential. I want these restrictions to be lifted as soon as possible. Of course I do. We've established task forces to work rapidly and closely with the sectors that remain closed to explore how they can be COVID secure, and I'm pleased to report that good progress is being made. Next week, we will set out a timetable for their reopening, though of course I can only lift those remaining national restrictions as and when it is safe to do so. Our goal remains to enable as many people as possible to live their lives as close to normally as possible in a way which is as fair and as safe as possible. And to achieve this, we need to move away from blanket national measures to targeted local measures. So instead of locking down the whole country, we will lock down specific premises or local areas where the virus is spreading. Instead of closing down non-essential retail and hospitality nationwide, we will only shut establishments locally as required. Instead of shutting all schools for most pupils, from September, we will only shut those schools where it is absolutely necessary to control an outbreak. And instead of quarantining arrivals from the whole world, we will only quarantine arrivals from those countries where the virus is sadly not yet under control. We're already implementing this targeted approach in England. In Weston-super-Mare, we identified an outbreak in a hospital, closed it to visitors and new admissions, tested all staff and patients, and gave the hospital a deep clean. The outbreak was contained and the hospital is open again. In Kirklees, we identified an outbreak at a meat packing plant, shut down the plant, moved in a mobile testing unit, tested all employees, and traced the contacts of those who were positive. The outbreak was contained and the plant has reopened with additional safety measures in place. And of course, more recently in Leicester, we identified a community-wide outbreak which was not restricted to a single location, unlike Weston-super-Mare and Kirklees. Public Health England engaged with the local authority, mobile testing units were deployed, full data was shared, council-wide data was shared on the 11th of June, postcode level data was shared last week. This enhanced monitoring through additional testing showed that the infection rate in Leicester was 3 times the next highest infection rate in any other city in the country. So on Monday, the Health Secretary announced local lockdown measures in Leicester for an initial period of 2 weeks. In each of these cases, the problems identified were specific to Weston-super-Mare, Kirklees and Leicester. So of course, it made sense to take action locally rather than reimpose restrictions on the whole country. We're learning the whole time. With each local outbreak, we see what works well and what not so well so that we do better next time. Informed by our experience of these cases, we've developed an approach for controlling future local outbreaks which has 5 principal components: monitoring, engagement, testing, targeted restrictions, and finally, as a last resort, lockdown. First, monitoring. Public Health England, working with the Joint Biosecurity Centre, will examine carefully data on the spread of the disease and people's behaviour across the country. They will look out for emerging trends, rising case numbers, and other indicators while taking into account local factors. Critically, we have made local data available to all directors of public health in local authorities so they too can monitor what's happening in their area. And local data will also be available to the public on the gov.uk dashboard. Second, engagement. If monitoring identifies local problems, NHS Test and Trace and Public Health England will work with the relevant local authority to develop a deeper understanding of the problem and identify solutions. Working with local agencies, we will seek to keep the local community informed at every stage so they know what's happening and what actions, if any, they need to take. Third, testing. We now have substantial testing capacity nationwide, and we have the ability to target that capacity at local areas in order to get a grip on emerging outbreaks. Scaled up testing at a local level, combined with contact tracing through NHS Test and Trace, can control the virus and thus avoid more stringent measures. Fourth, targeted restrictions. If the virus continues to spread, we will restrict activities at particular locations and close individual premises. As in Weston-super-Mare and Kirklees, we will restrict access to places which become hotspots for the virus, while testing people who have spent time in those places and tracing the contacts of anyone who tests positive. Fifth, local lockdown. If the previous measures have not proven to be enough, we will introduce local lockdowns extending across whole communities, as in Leicester. That could mean shutting down business venues that would otherwise be open, closing schools, or urging people once more to stay at home. Local lockdowns will be carefully calibrated depending on the specific circumstances of each outbreak, and we are continually exploring smarter means of containing the virus. So that is the approach we will take as local outbreaks occur, and we will set out more detail soon. Let me end by looking forward to this weekend. Tomorrow, there will be a moment of remembrance for those whose lives have tragically been lost before their time. And at 5 p.m. on Sunday, the NHS's 72nd birthday, we can all come together to clap those who have worked tirelessly and selflessly to help the nation get through this pandemic. I know everyone will be looking forward to the relaxation of national restrictions. As lockdown eases, we should focus on supporting the livelihoods of business owners and their employees up and down the country, all of whom are opening their doors for the first time in more than 3 months. They are our local restaurants, hairdressers, libraries, museums, cinemas, and, yes, pubs. They're also our hotels, B&Bs, indeed much of our tourism industry. All these businesses and their workers have put in a heroic effort to prepare their venues for this reopening, to work out a way to trade that keeps their customers safe. But the success of these businesses, the livelihoods of those who rely on them, and ultimately the economic health of the whole country is dependent on every single one of us acting responsibly. We must not let them down. Lockdown only succeeded in controlling the virus because everyone worked together. And we will only succeed in reopening if everyone works together again, because we're not out of the woods yet. The virus is still with us, and the spike in Leicester has shown that. If it starts running out of control again, this government will not hesitate in putting on the brakes and reimposing restrictions. Anyone who flouts social distancing and COVID-secure rules is not only putting us all at risk, but letting down those businesses and workers who have done so much to prepare for this new normal. So, as we take this next step, our biggest step yet on the road to recovery, I urge the British people to do so safely. Remember, don't gather in groups of more than 6 outside or 2 households in any setting. Keep your distance from those outside your household, 2 meters if you can, 1 meter with precautions if you can't. Wash your hands. Let's all stay alert, control the virus, save lives, and enjoy summer safely. Thanks. Do either Chris or Patrick have anything that you want to say? No? Okay, well, I think in that case we will go straight to our questions from members of the public and the media. And we've got a question first from David from Milton Keynes. David.
The event industry has been decimated by the restrictions put in place to combat the COVID-19 situation. With no end in sight for these restrictions, our industry faces a long period of enforced closure. Will the government offer any further assistance to the event and arts industry to ensure that it survives the next few months? Thank you.
Well, thank you very much, David. And the events industry, the arts industry, the theatre sector, all of them have had an incredibly tough time. And I know how difficult it has been. What we've tried to do, David, is to support every sector of the UK economy, jobs, incomes to the tune of £120 billion so far. I know that particularly in the events and arts industry, people are anxious about when it's going to be their turn to unlock. And that's why I've announced tonight that we will next week be setting out a timetable so that we can get you all preparing, get underway, and make sure that we're working together to get your businesses as COVID secure as we can possibly make them. We'll be setting out a timetable next week. But David, the crucial thing is that we want life to get back, as I said, as fast as possible to as normal as possible, get the disease down so that the events and arts industry really have a chance of recovering. But you can also take it, David, that we will be doing everything that we reasonably can to support you, to support the arts, the theatre, the events world in the interim. Nothing from either Chris or Patrick. I thank you so much. Can we go to Hina from Leeds, please? Hina asks, there are fears of a second wave from doctors and those who are experts in the medical field. What are the contingency plans in place if a second wave was to occur? Well, I'm going to ask both Chris and Patrick to come in on this, but clearly that, a huge amount of work has been devoted to the possibility, of a second wave ever since the disease arrived in this country and indeed before, because our anxiety about the second wave has been very much at the forefront of our minds. We will obviously keep all sorts of measures in reserve. The local lockdowns that I talked about, the regional lockdowns, a national lockdown, of course, has to be, as it were, the response of the ultimate resort. We really don't want to do that again. We really don't want to do that again. So we will also be looking at other ways in which we can respond to the possibility of a second wave that reflect the vulnerabilities of particular groups and the prevalence of the second wave in certain areas, and we'll be bringing forward more detail about exactly how we propose to do that shortly. But I wonder whether Chris and Patrick want to say anything more about the second wave.
I mean, a second wave is something which everybody, I think, realises is a possibility, and in fact we're beginning to see the possibility of some second waves elsewhere in the world, and this possibility will exist with us for a very long time. So we have to prepare for that, and there's a lot of preparations going on. Clearly the best thing to do is to try and make that as unlikely as possible, and that's why the points that the Prime Minister was making about as the economy is opened up, all of us taking that extremely responsibly, sticking to the social distancing rules, sticking to the 2 metres if we can, 1 metre plus with mitigations if we cannot. All the other things that have been recommended, ranging from the simple things like washing our hands to using face masks on public transport, all of these things are absolutely essential. And if individuals, families, firms do not take them seriously, the probability of a second wave goes up very, very sharply. But there are, of course, also things, winter is one of them, which may work to the virus's advantage, even if we are, all of us, working incredibly hard, and we have to be ready for that possibility. And clearly there are plans, and as the Prime Minister says, they start off with dealing with local outbreaks, and then it is possible to gradually escalate. But what we want to do is minimise the chance and then deal with individual outbreaks as they happen.
Well, I completely agree. The key is to make sure that the COVID secure approach is across society. We all stick to it. It's particularly important as the measures are released now that we stick with the rules as Chris has described them. And that should be enough to keep this under control. But we'll still see local outbreaks. There will be an increase in local outbreaks. There's no question about that. And we need to be able to monitor and deal with those. And then we need to make sure that by keeping to the rules, we reduce any upswing nationally, and we try to make sure that as winter comes, which is the big risk, that we're prepared to be able to deal with it. So this isn't something that's gone away. It's something that's been suppressed, and we need to make sure that we keep it suppressed through living with the rules we've got for a more COVID-safe world.
Absolutely. The only thing I would add is if you compare our situation now, Hina, to where we were in February or March, there's two tools that we now have, possibly that we didn't have, or certainly that we didn't have back then. And one is, of course, the therapeutics that are now available, particularly dexamethasone, which was trialled and pioneered, whose use was pioneered in this country, which is effective to quite a large degree in reducing mortality, which is an important thing, and our drugs preparations will get better. But we also have NHS test and trace, which will assist in those that local crackdowns, those local lockdowns where we need to do them. But that doesn't mean we can be remotely complacent. As Chris said, we really have to be disciplined in order to get through this, and the virus is still out there, as Chris and Patrick have said. Let's go to Alex Forsyth of the BBC.
Thank you, Prime Minister. Tomorrow has been described as Super Saturday. Are you confident at this point that you've struck the right balance between the country's health and the economy? And are you confident you've got the right public messaging? And to the scientists, if I may, are you comfortable with the pace that this unlocking is progressing? And Prime Minister, can I put to you, the First Ministers of Wales and Scotland have described your travel quarantine plans as shambolic. Are they right?
Well, first of all, on the Alex, on the balance, it is incredibly important to get the balance right, and our priority is health. Our priority is the health of the British public and of our country, and we look at where we are with the prevalence of the disease down to 1 in 2,200 now. We look at the efforts that the public have made. We think that this is the moment, cautiously, to reopen the hospitality sector in the way that we're doing. But our advice to everybody is to respect the guidance, 2 meters or 1 meter plus mitigations, wash your hands, use face coverings when you're in a confined place amongst people that you don't normally meet. All those things are very, very important. And if we do that, I think we'll get through it, and we'll get our businesses, our hospitality sector back in the way that they want. And before I ask Chris and Patrick to come in, I'll just say something on the decisions on quarantine and air bridges and how all that's going to work. Actually, I think we've trailed this for a very long time. Alex, we've always said that we would have a strong quarantine regime in place, and that's what we are going to have for large numbers of countries around the world, where I'm afraid the disease is still prevalent, or indeed becoming more prevalent. We're going to keep the 14-day quarantine system. There are some countries, and the list has been published today, where we have reciprocal air bridge arrangements. I know that administrations in Wales and Scotland, may have their own take on this. But my impression of the way we've been working as a UK is that generally speaking, we are following very, very similar paths, if at slightly different speeds. Anything you want to say on that?
I mean, the only in terms of pace, we really should be realistic that there are really serious risks on both sides of the path that we as a country, we as society are trying to walk. Go too far one side and the virus comes back again. Go too far the other side and we get even further, and I speak as someone, this is a medical point, increases in unemployment, deprivation increasing, and all the social ills that go with that. So we are either side of the path we're on, there are risks, and we're going to have health problems and we're going to have economic problems for sure. So what we're trying to do is walk this narrow path. There is no perfect time, there is no perfect exact way of doing it. What this is an attempt to balance as best we can the multiple risks in a way that makes it possible for society to be as close as possible to normal whilst living alongside this virus, which we will have to continue to do. This virus is a long way from gone, but it's not going to be gone for a very, very long time. It's now a lot lower than it was. Currently, all-cause mortality is now back across the entire country at roughly the normal rate for this time of year. So this is a reasonable time to look at this balance and actually say, well, we're going to have to take risks whatever we do, and this seems a reasonable package of risks at this particular time, at this particular pace. But none of us believe, and I'm sure nobody watching this believes, this is a risk-free next step. It is absolutely not, and that's why we have to be really serious about it, wanting to support all of the businesses that are opening, wanting to support all the people who are wanting to meet loved ones, but at the same time being really disciplined, all of us, about trying to do all the things that make it less easy for the virus to come back again, because these twin risks are going to be with us for a very long time.
And measure, get tested if you have symptoms,
Yes.
Make sure that we track, we can understand and work out where outbreaks are occurring. That's what's key. So the test and trace is terribly important as part of this as we go into the next stage, and we need to measure in order to know what to do next.
Thanks very much. Paul Brand, ITV News.
Thank you, Prime Minister. You're asking people tomorrow to use their judgment, but what is your judgment? What is it that you want people to do? Are you saying that we all have a duty tomorrow to get out and spend? And to the scientists, it's one drink in a pub if you want to drive. Is it one drink if you want to safely socially distance, or can people think they can have as much as they want?
Thanks very much, Paul. Well, I think that my view, my urgings to everybody can be summed up in the phrase "enjoy summer safely." I mean, I do want people to feel that it's safe to go and enjoy themselves, to enjoy hospitality, but it's got to be done in a responsible way. The heads of parties got to give their name, contact details of everybody behind the bar, behind in the restaurant or wherever. Got to be done. Got to observe social distancing, wash hands, and this will be a success. If not, as Chris says, the risks are there and they're obvious. And I'm afraid that the risks are absolutely manifest in other countries that we know and love well, where there are difficulties, and we've got to look at that and think we don't want to go down that route. There are ways of avoiding it. We can do it if we do it together. So enjoy summer safely.
And that applies also to alcohol.
Yeah, absolutely. Couldn't agree more. Thank you, Paul. Andy Bell, Channel 5. Andy. Can you hear us, Andy?
Yeah,
Thanks, sorry.
Apologies. Thank you very much, Prime Minister. We haven't managed to arrive at a UK-wide system for quarantine people travelling in and out of the UK. So what do you say to, say, a family in Scotland who say, well, we'll drive over the border into England, fly out of England, back into England, and get around any quarantine difficulties in Scotland? Would they have your blessing? Would you say that was perfectly fine? And for the Chief Scientific Advisor and the Chief Medical Officer, was there ever a medical scientific justification for the blanket quarantine we imposed back on June the 8th?
Well, first of all, Andy, I just really go back to what I've said earlier. I mean, I know that the DA, the devolved administrations in Scotland and I think also in Wales have a slightly different take on this. But my observation through the long weeks and months of cooperation on this is that the convoy is really going in very much the same direction, maybe at slightly different speeds, and I'm sure we'll get that together, and that common sense will apply.
I think on the second one, our advice has been clear that the quarantine makes most sense and can be used effectively when people are coming from countries with higher infection rates than the ones we have here. And that's where quarantine is a measure that would make a difference.
Thanks very much, Andy. Chris Smith, The Times.
Thank you. Firstly, can I just follow up, Prime Minister, on some of your comments this morning on cricket, which suggested that scientific evidence you're getting suggests that the ball may not be such a vector of disease after all. And if so, and if everyone behaves themselves while having tea, can we get back to playing cricket soon? And then on tomorrow's easing, Sage papers out today identify bars and pubs as among the principal sources of super spreading events. So given that, can I ask Sir Patrick and Professor Whitty how concerned they are about what's going to happen tomorrow and what kind of surveillance measures need to be in place to make sure it doesn't lead to runaway chains of infection? And Prime Minister, Sage modelling also suggests that it's going to be touch and go getting all schools back in September, even if it all goes well, and that some other things, such as pubs, might have to close to allow it if people don't follow the rules. So are you telling the nation overdoing it tomorrow and during the summer risks children's education in the autumn? And if it came to it, would you prioritise hospitality or education?
Right. Okay. Let me go first on education. Chris, look, we're absolutely determined and resolved to get all pupils back in September. Gavin Williams, Education Secretary, has set out a very, very good plan for doing that. I urge our friends in the teaching unions to work with us, and let's do it. I think it's the right way forward. It's wrong for pupils to be out of school for so long. We can do it in September. We must do it in September, provided we all behave responsibly and keep the virus under control. Indeed, I would like to see, before the holidays in July, we're seeing more pupils now coming back in early years and reception years 1 and year 6. The numbers are coming up now, and that's great to see, and also years 10 and 12. We could have even more. Some schools are making it clear that, many schools make it clear that they have room for more pupils now before the summer holidays. I think it'd be a great thing if pupils came back now, as well as getting all pupils back. So the pupils that can come back, I should say, come back now, and all pupils come back in September. On your question about cricket, I just want to be clear that I wanted, having been stumped on the radio this morning on that point on the science again, and being asked about which was the exact vector of the disease. I've sought scientific advice and a medical opinion. The third umpire has been invoked, and what I can say is that we do want to work as fast as possible to get cricket back, and we will be publishing guidelines in the next few days so that cricket can resume in time for next weekend, or cricket can resume next weekend. I think that's what we're able to say today. But I wonder if I could ask Chris perhaps to just elucidate everybody just a bit more about the thinking behind cricket, the numbers, what the issue has been, because I think there are important questions people want answered about the potential transfer of the disease in cricket.
Thank you, Prime Minister. I mean, on cricket, one of the issues on cricket is it brings together a much larger number of people in terms of linking households than you do the 6 people that is laid out as the maximum number of people who should be meeting even outdoors close now. But it is perfectly possible to have cricket where people do keep their distance, and provided people don't do things that are clearly not sensible, ranging from hugging the bowler if they've just bowled someone for a duck through to spitting on the ball, it should be possible to make the game itself really very safe, because it's an outdoor sport at a distance. It's not a contact sport in the sense that some of the high-risk outdoor sports are. There are, however, risks associated which we just need to think about and deal with, and these are perfectly manageable. But the particular ones would be people going in afterwards in a crowded space, for example, in the pavilion to have tea or a beer. And this comes on to the pub issue. The biggest risks are when lots of people from completely different households are brought together in close proximity indoors. And whether that's in a pub or a cricket pavilion, that is a high-risk activity. And that's the reason why the really quite onerous social distancing guidelines that are going to cause a significant change to pubs and cause difficulties for many publicans, and we all recognise that, are so essential. There is no doubt these are environments whose principal job it is to bring people together. That's a great thing to do socially, but it's also a great thing from the virus's point of view. And therefore, we do have to have really clear and really disciplined approach to trying to maintain social distancing whilst also enjoying pubs. And this would be true in any other environment.
You're quite right to identify there are environments in which super spreading is more likely, and that's what why super spreading occurs. And those environments are indoor environments where people are crowded, they can't socially distance, and they're together for a long time, and you're connecting lots of different households, as Chris has said. So the answer is, don't let pubs become like that. Make sure you've got the appropriate COVID-secure environments, and people can be distanced appropriately to try and reduce the risk. But whatever we do, the fact is that indoor environments which become crowded and people are there for a long time present a risk for spreading.
Brilliant. Thanks very much. Kate Proctor of The Guardian.
Thank you, Prime Minister. You've said that you won't hesitate to slam on the brakes if the pubs reopening doesn't quite go to planned. Would you consider completely shutting pubs if you can see in a few weeks that this isn't working? Is that the kind of handbrake measure you're referring to? And secondly, your father travelled to Greece against non-essential travel advice. Dominic Cummings was seen to have broken the spirit of lockdown rules by travelling to County Durham. Why should the public obey all the rules that you're putting out at the moment on the pubs reopening when it does feel as though those close to you flout the rules?
Well, thanks very much, Kate. Well, first of all, on the episode in Durham, the Durham police made very clear that they weren't pursuing that. I'd make it a normal practice not to comment on the movements or doings of my family. But what I can tell you is that actually, when you look at what the British public have done over the last 3 months, it has been a phenomenal effort to follow the guidance and get this thing under control. And people have worked together, and they've done an absolutely heroic job. And that's why we've got incidents running so much lower than it was only a few weeks ago. It's because of the collective efforts of the British public. We've got to keep that going now. I don't want to close all pubs at all if we have a further outbreak. What I've tried to say, I think you meant, do you want to close all pubs in the country? I don't want to get back to another national lockdown of that kind. We want to deal with local outbreaks, with local lockdown measures, and we're greatly assisted in our ability to do that by the test and trace operation. You've seen it work in Kirklees, in Ashford, Weston-super-Mare. We've had to do a big one now in Sheffield, but that is the approach that I want to take. But obviously, we have to retain all measures in reserve. I don't think there was a question for either. Thank you so much. Thank you. Harriet Line from PA.
Thank you, Prime Minister. You said today that people should wear face coverings in confined spaces, but many people aren't. So are you considering making them mandatory in shops, as has happened in Scotland? And to the scientists, do you agree with Jacob Rees-Mogg that pubgoers should drink a yard of ale to celebrate pubs reopening? And is there any evidence that the protests, raves and crowded beaches that we've seen in recent weeks, where people haven't been obeying social distancing rules, have led to an uptick in infections?
Well, Harry, I think we're sticking to what we're saying on face coverings, which is, look, when you're in a crowded space where you're with people that you don't normally come into contact with, the tube is an obvious example, but shops is another one, then you should wear a face covering. But Patrick and Chris, is anything you want to say?
I'm going to let Chris deal with the yard of ale, but the uptick of infections, we haven't seen anything from those sorts of events yet. Doesn't mean we won't, but there's been nothing that's been seen yet. And the same is true actually in some other countries where outdoor events have taken place. There hasn't yet been any indication we've had an uptick, but it's obviously something that needs to be looked for. And I'm sure Chris will comment again on alcohol and doing things safely and sensibly.
Well, I seem to remember that Mr. Rees-Mogg said that he was going to buy the yard, but didn't say he would drink it. People clearly need to stick to the usual kind of sensible guidelines on drinking and enjoy it.
Yeah. And I can tell you that I will certainly buy and drink a pint, but not a yard. And I really do just repeat the message to everybody. This is a big turning point for us. We've got to get it right. Let's work together and enjoy summer safely. Thanks, everybody.